uh, oral cancer is also a big problem as far as oral hygiene and everything is concerned. So what can be the very early symptoms one can understand and then immediately go to see a doctor?
For oral cancer, there is definitely history associated with the patients. If somebody is eating that chronic smokers, right, and somebody is eating that gutka, pan, and other all kind of things, so those kind of people should be more aware related to their oral status. Early signs, it starts from white patches, okay? White patches, we call it leukoplakia. Okay? That leukoplakia is very early precancerous condition, so one should be cautious during that stage itself. And if somebody is not stopping their habits, okay, I've seen people from leukoplakia, they advance to more, further stages, okay. They do have the proliferative growth kind of thing, some lumps kind of development in the some mandibular regions. So those people should be more aware of it. Those are the very early signs of cancers.
Okay. If I have to tell a layman, so suppose the person is not a gutka consumer, can that person also develop oral cancer?
Yeah, even those people, if somebody is not having history, I have seen people with non-history as well developing cancer kind of thing. Even we have encountered patients who are having a routine ulcers, and those ulcers which are not healed for months and months, even those are being, transferred for oral cancer kind of thing. They are non-healing ulcers. They start from that ulcer thing, it becomes, proliferative, the size increases, and those cases, they eventually, get into oral cancer, full-flourished oral cancer.
Okay. Yeah, long back, I had a friend, and then he was telling me that, if you place 3 fingers and you ask the person to open the mouth, and these 3 fingers can go inside, this mandible is flexible, that person more or less is not having a major problem even after eating gutka or something. So that was like a first-hand checkup you can do at the home and understand whether your mandibular functions are all okay or not. This is about that or something.
Even I have seen people who are not, gutka chewer. Okay. Some people have very limited mouth opening. It is only not related to that chronic condition of OSMF, that is oral submucous fibrosis, which leads to that trismus kind of thing, that 1 finger or 2 finger opening. It is only not related to that OSMF thing. There are many other conditions as well from which we have that limited mouth opening. That is all related to muscles of mastications related. Some people, they develop trismus because of ankylosis of the mandible also. And mandible is this joints, okay. The bone gets stiff, even sometimes the muscles get stiff. So that also leads to, limited mouth opening.
Oh, okay. So this is something very new to me, because and I have seen people even not even eating gutka or chewing any sort of tobacco, but still they develop mouth cancer. Right. So even if you say to prevent oral cancers, is there, like, apart from maintaining the oral hygiene, apart from brushing twice a day, anything else one can do?
To see, one should discontinue with their habits. That is the first and primemost thing the patient can do. Just to discontinue your, bad habits. Okay. That's the first stage. And one should always get the biopsy done. That is the one stage. At least one should be known at what stage my illness is. Okay. If somebody is having normal leukoplakia, they should get that biopsy done. At least they should be aware at what stage they are in. Okay.
But again, coming to biopsy, I've seen people only go for biopsy when they have certain sort of tumors. And then doctor says, this tumor has to be surgically removed. And then the biopsy comes into picture.
Dr. Somnath, there is something called as excisional biopsy. Okay. Excisional biopsy, somebody is having that lesion. We entirely remove that lesion. Okay. Then we send that specimen for routine histological examinations. just to know that exactly what kind of dysplastic activities are there in that tissues.
Okay. 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 Then I think one more, which is a common question these days, is like tooth aligners. Are the tooth aligners are good? Earlier, we used to see, people used to wear braces for years and then they used to align it. Nowadays, invisible aligners have come. So, what has changed? And are tooth aligners, recommended?
It is recommended. It is new paradigm shift in routine orthodontic treatment. They are good. It is good for lazy people who do not wear, who do not opt for, fixed braces. It is good for those. It is even good for those people who cannot routinely visit their orthodontist every month. It is good for those people, aligners. The company that comes, they scan your mouth and they will give you a set of trays which you need to wear it regularly in a scheduled manner for the desired results to happen.
And what is the, how many months we need to wear them?
It depends upon case to case. Minimum 8 to 10 months. It takes time for the visible, noticeable changes to be, noticed in your teeth alignment.
Usually, we had a concept that, when you're in a growing stage, your alignment fits better if you go with the braces.
See,
so is there any age limit?
For age, there is no age limit for braces treatment. Definitely, we do recommend in the growing phase. We recommend braces treatment at onset from 13 years till 20 years. That is the ideal year for braces treatment. But if some or other reasons that has not been done, we can even do at a later ages. But only thing is that treatment result will take more time. In a growing phase, we can mold in a good manner your jaws in a shorter period of time, right? But in adults, it will take slightly more time because the bone is more condensed. For young patient, the bone is more soft. We can move easily. But for adults, they have achieved that growth kind of thing, right? So it is slightly more time taking for the adult patients.
So coming to surgeries, in dental surgeries, do you think there has been certain advancement in terms of technology has happened these days?
Yeah, definitely there are also advancement in technology. Nowadays, we are using lasers. Yeah, we are doing lasers for routine dental surgical things. So there are a lot of advancements in dental field as well related to surgical aspects.
Yeah, I think one of them is very popular is root canal treatment. Right?
That is
What is it all about?
That is the routine treatment. Every side. Almost in dentistry, 90% of the patient they come with dental pain. And once the pain starts, everyone land up in root canal treatment only. If somebody is keen to save their teeth.
So in root canal, your teeth will be preserved?
Yes. The tooth will be non-whitened. Okay. That sensitivity kind of thing won't be there, but otherwise that cosmetic effect and that functional effect would be maintained.
Okay. So if for RCT, is there any limitation on which teeth it can be done, or it can be done for all the teeth?
It all depends case to case. Okay. It's not like that every tooth can be done root canal. If some tooths which are absolutely shaky, it is very mobile in the jaws, we do not go for root canal, we do the extractions. If some tooth are, fractured, right, too much, we even cannot save that teeth. This all depends upon case to case. We do the case selection.
So in general, and ideally, RCT is recommended for molars, premolars?
It's even recommended for front teeth, anterior teeth as well.
Oh.
Because, front teeth, they are for cosmetics and your back teeth are for chewing functions. So it is recommended for most of the teeth. Usually we don't do root canal for molars because at the back it is very difficult to reach at the back of the tooth. Usually we extract molars, third molars.
Wow. So, that will be highly compromising on the chewing parts.
They are right. But rarely third molar helps in chewing.
Okay. So there is also like I'm telling it relevant to my thing is, interestingly, my wisdom teeth on the lower side has come up, but on the upper jaw there are no wisdom teeth, and it has not come out. And I've done an X-ray; there is nothing inside also. So is it something rare or it happens frequent?
It happens with some patients. It happens. The tooth, they do not get sufficient space in the jaws to form or erupt. So with evolution, our jaw size, they have shrunk. Earlier, our ancestor used to have 32 to 32 teeth in their mouth. But nowadays, with evolution, our jaw size has reduced. It is all related to our refined way of eating, right? So because of that constricted jaw size, all our 32 teeth are not able to accommodate. So that's why most of the time we encounter that third molar, either they do not erupt or they come out partially, and those at times they do cause troubles.
Oh, okay, okay. So when I went to my dentist last time, he said, you don't have wisdom. I got a little bit scared. Okay, great. So coming that same thing is like, for dental fillings, like people go for fillings and there are different types of fillings. Some look white, some look black. So what are these fillings all about?
See, when dentistry started, the first and foremost material for routine filling used was amalgam filling. So that color of amalgam is black only. Okay. But with changing, evolving of materials, nowadays we have modern materials which are more tooth colored. Okay. We have various materials. Nowadays, amalgam we are not using. Okay. We are using more tooth colored material. We have composites, we have GICs, we have many more materials which we routinely use in clinical practice. And most of them are tooth colored only. Rarely people, they go for, amalgam fillings.
And what is the shelf life of these fillings?
See, it all depends from area to area of the tooth in which it is filled. If it is filled in the center, it is not going to go anywhere. If spilling is more towards, proximal sides, one should take care of the biting forces also, so that, it is maintained and preserved for a long time. Ideally, we claim, also the dentists, they claim they will serve you lifelong.
So I think you are doing a fantastic job. And I know oral health is something which we should be talking more frequently. This is one segment, somehow, as you said very rightly, unless you have some serious problem, we don't even bother to go and see our dentist on a regular basis. Unlike other countries where, it's more or less like a routine checkup every 6 months or, every few couple of months, they need to go and check. So that is something in India, that culture is gradually coming.
People are slowly people are slowly getting aware of, oral health, importance of oral health. They are gradually getting more aware of it.
Great. So thank you, Dr. Rajesh. So you are doing a wonderful job. Thank you for your valuable time and coming on this platform. Thank you.
Thanks, Dr. Sona. Thank you.